Elsie Coe with Lead Physician. Are you experiencing burnout? I think most of us have experienced burnout to some extent. When do we know that we have to see a psychiatrist? When do we know that we need just coaching or there's something that we could do at home? I have an expert here, Dr. Paul Roy, who's an expert psychologist in burnout. And he's been working with the armed forces in Canada, helping them with PTSD. And how has that helped him become an expert in helping with physicians and other healthcare workers in burnout? And he's developed this whole multidisciplinary platform. We're going to talk about that. Welcome, Dr. Roy. Paul, how are you?
Hi, well, thank you, Elsie. I'm very well, thank you.
Great. Paul, I just wanted to ask you, tell us a little bit about your work with the armed services and how do you feel that has equipped you to help all these healthcare workers who've experienced burnout, especially with COVID?
Yeah, well, I've been working with soldiers for about 10 years, and many of whom are Afghan vets. They were in battlefield situations in Afghanistan, and some of whom have come back with very serious PTSD, depression, addictions. And it occurred to me that the culture in the military is not dissimilar from the culture in medicine, in the sense that doctors are programmed to regard themselves as, well, we can't be weak, we can't take a knee, we can't ask for help, much like soldiers, and soldiers will say that to you. There's a huge resistance among soldiers to get medical psychiatric help, even when they have serious conditions like PTSD. Often it's years after they've returned from very serious battlefield situations, and before they will come forward and ask for help. So and as the soldiers would say, it's their words, not mine, is we're not going to take a knee. We're not going to ask for help. It's not our culture. And I think
that sounds familiar, Paul.
Well, sure. And as a physician, you know that's our culture as well. Is we can't be weak. We can't ask for help. It's hard for us to acknowledge that. And so I think that was part of the impetus for me saying, look, I think the second thing that working with the military illustrated for me is that I work in a multidisciplinary team. Now, that's something I've done for years and years. But a soldier can walk in and expect to be seen quickly, expect to have a proper diagnosis, and then there are 3 or 4 different types of care that individual can expect to receive relatively quickly. So, for example, if they need psychopharmacology, it's there. If they need more sophisticated psychological testing, maybe they've had a traumatic brain injury or something like that, that's there. Mm-hmm. If they need psychotherapy, trauma-specific psychotherapy for PTSD, mm-hmm. And there are at least 2 types of therapy that are available now and that are used all over NATO countries, mm-hmm. that's there. And there's people that are trained and can provide that.
Right.
There's also addictions counseling, as is very prevalent. A lot of people self-medicate, right? They don't want to ask for help, but they'll use mostly alcohol, but they'll use other things to self-medicate. So that's there for them. And then there's career counseling, as
right.
well.
Right.
So do I stay here? Do I go? So what I learned is that physicians have this same difficulty asking for help. But also what I learned is that in a lot of jurisdictions around North America, there aren't really the resources. There are not these multidisciplinary teams where a physician can just go and say, look, I really need help. I'm in way over my head here. I don't know what's wrong with me. I don't know if I'm clinically depressed, if I'm burnt out. I may or may not have an addiction issue. I'm having problems with my family, and somebody may not be able to discern for themselves what's going on, even if they're a physician, and they shouldn't. They need help at that point.
Right. So let's talk a little bit, Paul, thank you for that, about your practice. It's called the Refuge Mental Health Services. And I want to know what it is that you mean by multidisciplinary um, um, therapy for healthcare workers. I see on your website, this is from your website, assessment, psychopharmacology, and peer support. Usually when I hear about somebody needing help, it's just one person that they go to, and it's behind closed doors, and hopefully it's confidential. Tell us about what's different about the Refuge Mental Health Services.
In some cases, seeing one person is sufficient. Okay. I mean, but what I've learned at treating armed forces personnel and what I know about physicians and morbidity and burnout amongst physicians is that very often seeing one person may not be enough. So it's just as I was alluding to, is that a physician has to come in and have a proper diagnostic assessment. You know, what is this? Is this burnout? Is this depression? Is there an anxiety disorder? Is it ADHD? What's going on?
Mm-hmm.
You have to have a proper assessment. And then the treatment modality, there may be 2 or 3 treatment modalities. They may need psychopharm, and they need somebody who really knows what they're doing. They may need a specific type of psychotherapy. Maybe it's CBT for depression. Maybe it's mindfulness-based CBT. Maybe they have PTSD.
Right.
How many of our colleagues have PTSD because of the trauma that they witnessed in emergency rooms or in their careers or in their personal lives? So they need something very specific intervention. They may need addictions counseling. Because they've been treating themselves with alcohol or something else. And they may ultimately, when much of this is resolved, then they may need some career counseling and some coaching and just say, okay, I've been an emergency room physician for 20 years, but I can't do this anymore. Just not going to do it. So you can see that one person is probably not going to provide all of those modalities. And so my vision is to have a multidisciplinary team, certainly under one roof, but also virtually under one roof. So you can provide care, let's say in a city, you're in New York or Toronto or Ottawa or wherever it is, but you can also provide distance treatment as well over a platform like this.
Right. So that's a good segue. I want to ask you, so what, I know you live in Canada, and you live in exactly where in Canada you live?
I live in Ottawa.
Ottawa. Okay. So I know you started off your practice helping local physicians, but now with the advent of this whole teleservices, tell us how far your services expand and who can reach out to you for what you do.
Well, I can treat anybody in the province of Ontario. Ontario is the size of France and Spain combined. There's about 14 million people.
Wow.
Major cities would be Ottawa is about 1.4 million. Toronto, I don't know, 5-6 million. Toronto is huge. So I can provide services anywhere in Ontario, at least from a medical standpoint. So that could be 1,000 miles away, 1,200 miles away.
Right.
But I can, because of the platforms that we have now, we can provide care, coaching, things like that to anyone in North America.
Got it. And how do we know when we need to see you, Paul? Like sometimes I feel overwhelmed. I might have some anxiety. I might be depressed, but maybe there's some things that, first of all, number one, what are the small things that we can do right now to help ourselves? And number two, when do we know that we need to reach out? And how safe are we with you that the other people won't know that we've seen someone like you?
Well, I'm bound to the rules of confidentiality. I may not share any information with anybody. The laws in the province of Ontario are probably the same in any jurisdiction in North America. As if I think a physician is an immediate danger to themselves or their patients, I have a duty to report that. But apart from that, in any other circumstances, I'm bound to confidentiality. I wouldn't, I'm not interested in talking to their college or anything like that. I have no affiliation with
Right.
For example, the Ontario College of Physicians and Surgeons. I have zero
Right.
responsibility to them.
Right.
When I think it's an issue of, I mean, it's always an issue of personal judgment, right? When do you need to reach out for help? I think if you feel overwhelmed or stressed,
Mm-hmm.
but you feel that perhaps you can talk to a colleague, or this is something that you can sit back and you can sort of think through and manage,
Right.
that's fair ball. I don't think you necessarily need to reach out to a mental health professional. When you need to do that is, I think, there's probably two vectors here. One is dysfunction. If you're becoming dysfunctional in your personal or professional life, you just go, look, I'm not practicing medicine in the way I used to, in the way I know I can.
Right.
I'm not interacting with my spouse or my children, or in my personal life, I used to be an avid runner, or I used to love doing X and Y, and I just have no interest in that. If it's beginning to reach into your personal and professional life, if it's beginning to affect your health, such as your appetite, your sleep is an important marker. You notice that your energy is just not there 80% of the time. Those are red flags. And I think my little formula is the first thing we need to do is stop. You need to scram the reactor. If it's getting too hot, stop and take time off. You don't need to take 6 months off. Doctors, I think, are threatened by the idea of taking time off or taking sick leave. There's
Definitely.
nothing too difficult about taking a week or two off and just gathering yourself and just saying, what's going on here?
Right.
I would ask for help. You have to ask for help. And so find a trusted colleague, friend, maybe another physician who really gets it, who understands what you're going through, and talk to your general practitioner. And maybe that's time for a full physical, and just kind of discuss that with your physician. It may be the case that that's enough to right the ship. That's enough to make you feel that you're back in control. And, a lot of burnout prescriptions are for self-care, rest, and creative outlets and things like that. If you can engage with that, that's terrific. That's great. I think next level stuff, though, is when it's really affecting your ability to function as a physician, when it's really affecting your personal life and your health. At that point, you and your physician may want to consult a mental health professional, which would be a psychologist or a psychiatrist. And at that point, I think you need to have a proper diagnostic evaluation. Is this burnout? Is this burnout and clinical depression? Is there an addiction problem that really needs to be addressed here? Is there an anxiety? I see a lot of physicians with anxiety disorders, with ADHD, that has never been diagnosed.
Wow.
And they get on we evaluate that, we get them on a stimulant, and they're just doing very well. Thank you very much. Mm-hmm. So, and then with the psychologist or psychiatrist, again, you need to evaluate other modalities of treatment that you need. Mm-hmm. Do you need an addictions counselor? Do you need psychotherapy for, as I said, PTSD? Do you need cognitive behavioral therapy for depression? And the other piece that's really, really critical, and I can't emphasize this enough, is career counseling. If you look at Maslach's work on burnout, and she really wrote the book on this stuff, she talked about burnout as being related to 6 factors, right? So in the workplace, excessive workload, a sense of lack of control or autonomy, no sense of community, no reward, you're working sort of in isolation, a lack of fairness amongst colleagues or the institution, and finally values. And is where you're working, is it consistent with your own personal values? So I think that part of our healing and part of what we need to do, is to think about those parameters. And am I happy with the content of the work that I'm doing? Have I evolved? Have I changed? Do I want to change the focus of my work? And am I happy with the environment, which speaks to a lot of Maslach's things, you know, fairness, community, workload. And what I always say is we should, in a prevention sense, as physicians, I would say about every quarter, we need to really stop and have a good think about these things. Is the content of the work that I am doing nourishing me, satisfying me, or have I evolved? What I did in psychiatry when I was training in Toronto 30 years ago is not what I want to be doing now, even though 30 years ago I loved what I was doing, but I just don't want to do that anymore, right? I've 30 years of experience. I've evolved, I've changed. We evolve, we change. You know, we have to think about the content, and then we have to think about the environment. And if it's not meeting our needs, if it's a toxic environment, or it is at least just an indifferent environment, it's not really giving us any support or anything, change it. Okay. And if you can't change it, I would suggest you leave.
Yep.
And a lot of us are afraid of change. We're terrified of it. It's like jumping off a ship.
We weren't taught how to be resilient about change, changing our environment. Yeah.
Yeah. And adapt and change.
The path has been laid down for us to go a certain direction. And then once we're there, we don't know how to change. Yeah. And
it's like jumping off a ship in the North Atlantic at 3 a.m. I mean, it's just, that's what we think of it. We're not stuck.
No.
We can change. Yeah. A lot of people change, and a lot of people end up being a lot happier. I mean, you're an example of that, Elsie. You've taken on different initiatives, and you're thriving. You're doing all this fantastic stuff.
Oh, thank you, Paul.
And that's inspiring other physicians. So change is not nearly as scary as we think it is, and it can lead to some really great things.
Thank you so much, Paul. So if somebody wants to reach out to you, what's the best way? And again, it's physicians, but it's also other healthcare workers. Let's just talk about really quickly, what other healthcare workers do you work with?
Frontline people, nurses. Mostly now it's physicians and nurses.
Got it. Okay. And what's the best way for someone to reach out to you if they just want to inquire?
On my website, in the contact, there's if somebody's asking for medical help, there's just a page they can fill in just a little bit about what they're asking for, and then there's another if it's a non-medical request, there's another email there, but that's the best way to get in touch with me.
Okay.
And I'd be happy to talk to anybody anywhere in North America. Again, I can't, for example, prescribe medicine if somebody's in the United States, but I can provide some coaching, some support. I can really help somebody say, look, this is what I think you need and where you need to go. Can certainly do that.
Right. I love what you're doing. I love the fact that it's a multidisciplinary approach, and you have such a background, Paul, that's unique. And you've helped the armed forces with PTSD and a lot of similarities. It's very interesting with those people who don't seek help until the last minute, and we're kind of like that. We're very stoic, and your background, and not just the medication, but also about career coaching and the addiction portion, and it's just fantastic. So thank you so much for what you do. Appreciate it.
It's my pleasure. Thank you for having me on, Elsie.
Yeah. So thank you, everybody, for listening in. I'm Dr. Elsie Ko with Lead Physician. We are starting up a leadership coaching program for physicians. So check us out at leadphysician.org and sign up or sign up for a call. And this coming Tuesday at 8:00 p.m. Eastern Standard Time, I'm with Dr. Pam Ludmar. We're going to be talking about the 30-second elevator pitch that you need to deliver when you're trying to get ahead in your career. So come and listen to us on LinkedIn, on Zoom, by signing up on the site on LinkedIn and on our Facebook page. So thank you. Thank you, everyone. Have a great Sunday, and See you next week at 10 o'clock on this page. Thank you.
Bye.